Hey everyone, welcome to the final week of the course. I hope you've all been wrapping up your week 6 papers well. So here we have your learning resources for week 7. This final week is all focused on evidence-based practice and research. You'll see here that you have 2 chapters in the Nichols book and 1 article which is required. Then you can choose 1 article from this grouping of articles. As usual, choose one which interests you, but it could be good to focus on choosing one that you might want to learn more about. Um, I also want to draw your attention to the websites this week. They are all family-focused practices that you will want to familiarize yourself with if you plan to do clinical work. Many of you have likely heard of these forms of therapy before. For instance, MST is commonly used within wraparound services and work with families of children with delinquent behavior. If you're interested in this, view the website and also read the Huey article, which is about multisystemic therapy. I also commonly refer families with young children for PCIT, the parent-child interaction therapy. I really wish I could say I was trained in this therapy. It's incredibly impactful, so please read up on it. It's used for children under age 8 who display behavioral issues, and they have kind of a really cool setup for how they kind of, they use the family, as that's commonly necessary for children of that age. Lastly, there's trauma-focused CBT. This is an approach which includes both individual and family components. I am trained in TF-CBT and use it often within practice. It has a strong evidence base for treating children who've experienced trauma, and can be useful for certain types of clients and families, though not for all. I've certainly found that for some, and this might be a personal opinion for me as a clinician, it can be a little rigid for some families. And, you'll find that, even though something is evidence-based, it may not be appropriate for every family or client that you might work with. So lastly, you have one video for week 7 to watch. In addition, you will be viewing a film of your choice, which will bring us to the discussions. So the first discussion of the week will be related to a film which is included within either of these lists. There's 2 lists here, and you can choose any film from those lists. For your post for the discussion, you will then be utilizing the theoretical approaches that you used in your integrative paper to assess the film. Be sure to use some major assumptions within those theories, relate them to the family, and cite your sources. Secondly, you will identify how you would use intervention for the family within the film. Please be sure to include the name of the film within the post. You do have a requirement of 2 references for the post, so I wanted to be sure to point that out. You are also required to post a response within this discussion. The response is slightly different than other discussions, as it should look like an extension of your classmates' post. It's not just opinions or reflections, but you will be providing suggestions based on what you have learned within the course, which means the response post will require a reference as well. For your second discussion this week, you will be looking at 2 of the websites I referenced previously. You will then be describing your understanding of the approaches from the descriptions and content within the websites, discussing strengths, discussing limitations. The second part is important to think about. You will be discussing strengths and limitations of looking at research when considering an approach for a family. This is important, as we know evidence-based treatment is very important to practice. However, this does not mean that every evidence-based approach would be appropriate for every individual or family. For this second part of your post, you might want to think about things such as sociocultural factors that could impact whether or not a particular approach would be appropriate for a family. And then you are not required to post a response for this discussion. For the final discussion of the week, you will relate to, it will relate to the video that's posted within Learning Resources. You will be responding to these questions, which will include describing theory and intervention used by the therapist in the video, You will also be reflecting on your personal thoughts on the video and also the course as a whole. Lastly, you will look at the case of Anita, the Widener social work shared case, and share how you might intervene with this family, knowing what you know now. Um, as with the second discussion, there is no requirement for a response post for this discussion. And then in addition to this discussions for week 7, please consider doing the end of semester evaluations for the course. Your feedback is so important to Widener social work education to ensure that the best education geared towards students is achieved. I also always appreciate feedback from students so that I can make sure that I'm doing everything I can and to improve myself as an instructor as well. So I thoroughly enjoyed joining you for this semester. I know it's been challenging along the way, um, but I hope you feel more secure in your knowledge of treatment of families, and good luck to all of you in the future.